नमस्कार दोस्तों, आप सभी का स्वागत है टॉक विद एन एक्सपर्ट में। आज हमारे गेस्ट स्पीकर हैं मिस्टर रुपिंदर सिंह और मैं आपका बहुत बहुत स्वागत करती हूँ। वेलकम
Thank you,
बैक
ma'am.
once again to our show, Talk with an Expert.
My pleasure, ma'am. I would be very happy to answer your questions, whatever points you feel I can elaborate on.
It is great to have you on the show, and since two people from the medical fraternity are once again back on the show, तो आज हमारा डिस्कशन भी कुछ वैसा ही होने वाला है। पहला क्वेश्चन मेरा आपसे है, post COVID, we have seen that the government has been pushing the R&D sector, be it through the financial budgets that we are seeing and the kind of technological advancements that we are seeing in the Indian industry. What are your thoughts on that, and how do you see these developments happening as somebody from the R&D sector itself?
Yeah, so that's a very good question. So the whole biotech ecosystem and R&D piece is being moved quite a bit by government. So if you look at, IIT entrepreneurship cell, so every IIT has, entrepreneurship cell. IIMs have a lot of NITs. Plus there are funding which is happening from BIRAC, DBT. So all of a sudden, last 1 or 2 years, I have seen a lot of activity which is being supported by government, which is being financially supported by the government. Government is rewarding those companies which are coming with innovative ideas. And on top of all that, even investors are showing a lot of interest to the companies who are having innovative products. So those companies who are trying to disrupt by having a better innovation for a product or a service, even investors are giving them better valuations. So I have several examples of such companies which got funding from IIT, which got funding from BIRAC, which got funding from DBT. And even investors have evaluated, the valuations are quite decent, because of the innovative work. So a lot of R&D environment is really charged up.
So it is safe to say that the kind of push that is being given by the government, that is very easily visible in the R&D sector in India.
Yeah, it is visible. For example, if you look at, prior to COVID, we did not have even a single company which was making COVID RT-PCR test or antigen test. And now look at, products like COVID Self, which is a self-use COVID antigen test, which is completely make in India product. And there is not one product, there are several of these products. And government is taking keen interest in pushing make in India entrepreneurs, helping them with coming out with their own products. So all that ecosystem is charged up, and you can see a lot of innovative products originating from India. Similarly, for example, last time I gave a very clear example that, when we started working on COVID vaccines, people were always, very skeptical about Indian vaccine. But the kind of vaccines which came out of India, and then, the way we vaccinated the population speaks itself about R&D and innovation support which is happening. So every sector in biotechnology, talk about genomics, talk about proteomics, talk about diagnostic, life science research, it is being supported by the government, I would say. So there is a increased trust. Though we don't have too many unicorns happening in biotech, but probably next 1 or 2 years, you will see biotech and healthcare unicorns as well.
So my next question is, when we talk of technology and when we talk of healthcare, there's a certain union that is happening and which is very evident in the industry now. Be it the apps on your mobiles, the prickless glucometers that are happening, the online consultations that happen via different apps, which they monitor the ECG, they monitor the blood sugar levels, blood pressure levels, and everything. What more, if a layman were to understand, is the future of this union looks like? What more technologies is the R&D sector looking at?
Yeah, so first of all, as you correctly said, e-commerce, app-based procurement of healthcare products, diagnostic products, research products. So you can see, the pharmacies, the kind of things which have happened with 1mg, Tata acquiring that, NetMed, Healthians, So healthcare and biotech is all getting onto e-commerce side.
Right.
Consultation is happening. Similarly, I think artificial intelligence and machine learning also will come in a big way. For example, today when you go to a doctor, and there is a chest infection, respiratory infection, so they take an X-ray, and that X-ray is actually being seen by consultant, a doctor, so he will look at the X-ray physically and then he will try to diagnose. But with AI coming in, and I have been, now mentoring and supporting some of these startups in India. So artificial intelligence based, software based, imaging based diagnostic softwares are available. So, it will scan thousands and lakhs of X-rays, and in one
Right.
snapshot it can scan all the respiratory diseases. If there is a tumor, if there is lesions in the lung, TB, COVID, all sort of things, so it is going to aid the process of diagnosis. Also, it's going to store all the information for even further
Right.
evaluations which have to happen in future. Tremendous change which is happening on the tech sector, I could say that. And these will also have very strong valuations when they go to the market, because these technologies, 1.37 billion people from India, they are going to benefit. But at the same time, you can actually go abroad and also use the same technology, software or app, data analysis.
Right.
So it's all pretty scalable, and it's happening now. It's happening.
So as a doctor, I can really predict that the kind of tremendous direct manifestation it would have on a normal running practice.
Yeah, absolutely. Another example which is coming to my mind is, for example, Down syndrome and a lot of syndromes. People were coming to know quite late in some cases, but now with AI-based diagnosis, just take the picture of this child, at the time of birth, or initial months, and one snap uploaded, and it all actually gives you, which syndrome it can be, based on the database and data analytics. It can
Right.
instantly throw an idea that these are the kind of things or abnormalities which can be there. So it's going to be technology all over, and biotech and AI, and these interfaces will create a lot of value.
Right. Mr. Singh, what vision did you have when you started your own organization? What kind of changes were you envisioning, and how did you want to change the biotech scenario in India?
Yeah, thank you for that question. Very close to my heart, and I keep talking about it all the time. So I was always dreaming of having my own biotech company, and some of my friend had shared that in US and all biotech is happening. So we thought that India, with such a vast population, will also have a lot of implications and a lot of focus in this field. So rather than working for multinational companies, which I did at very senior positions, but I always wanted that one day we should produce goods out of India, because I know these multinational companies, I should not say this, but they overcharge, so in the same money, we can have at least 2 times or 3 times more product. So which means, 2 to 3 times more productivity for a scientist, 2 to 3 times more productivity for a doctor, for a patient. So in the same money, we can actually have 2, 3 times more output, at least to start with. So my vision always was to have, so India should have its own products rather than, we are being dictated by outside world. And that is the motto of me starting biotech company. And those days when I started, there was no VC funds available. There were
Right.
no angel investors easily available. So we had to resort to our own either bootstrapping or getting funds from the bank. But nevertheless, scenario kept changing. But the desire is becoming more and more intense as we progress. So I'm even more bullish now.
Wonderful, wonderful. Another question to you is we have seen a lot of discussion about genome sequencing.
Hmm.
Now, for a layman, I would ask you what genome is. Why do we do genome sequencing? Is it beneficial to humankind? And does it hold any good future for the mankind?
Yeah. So that's a very, very relevant question. And I think every person on this earth should know it, that we are what we are because of our DNA. Whatever we are is all because of what DNA we have. We inherit DNA from our parents, and that is the sole basis of what we become finally after interacting with the environment. So we are all because of DNA in our cells. So for example, थोड़ा इसको और आसान कर देता हूँ, that when a kid is born is actually because of DNA from sperm of father and mother's egg. So because of that DNA we have the whole development work. Everything is very well defined in the DNA itself. So आपके दो हाथ बराबर होंगे बिकॉज आपका यहाँ पे जाके वो सेल डिवाइड होना बंद हो जाएगा आफ्टर सो मेनी बिलियन डिविजन्स. इट हैज टू स्टॉप हियर. इट हैज टू स्टॉप हियर. अगर यहाँ पे दो उंगलियों के बीच में यहाँ पे एपोप्टोसिस नहीं होगा, प्रोग्राम सेल डेथ नहीं होगी, तो ये उंगलियां मेरी फ्यूज होगी. मेरे दोनों हाथ बराबर हैं, मेरी दो आंखें हैं, मेरी आंखें पीछे नहीं लगी है, सामने लगी है. इट इज ऑल बिकॉज everything is mastered in this universe through genetic material which is DNA, and DNA is like a thread, it's like a ribbon जो हर सेल के अंदर न्यूक्लियस में प्रेजेंट है और वो रेप्लिकेट होता रहता है डीएनए. सो डीएनए से देन इट मेक्स आरएनए, आरएनए मेक्स प्रोटीन, एंड बहुत सारे जीन्स है, मतलब बहुत सारी फंक्शनल फैक्ट्रियां हैं डीएनए के ऊपर. बट जो जिसकी जब जरूरत है वो जीन या डीएनए का पीस ट्रिगर होता है, उसका प्रोटीन बनता है. अगर मैं अभी एकदम आप और मैं इंटरव्यू कर रहे हैं, यहाँ पे शेर आएगा, तो हमारे सेल्स को बताना नहीं पड़ेगा क्या करना है. उसके लिए जो भी रिसेप्टर, जो भी एंजाइम, जो भी हार्मोन सिक्रीट होंगे, जो आपको एक्स्ट्रा एनर्जी भागने के लिए पड़ेगी, all that is programmed through DNA, RNA, protein, which is called as central dogma of life. पूरे यूनिवर्स को यही सेंट्रल डोगमा कंट्रोल करता है. डीएनए से आरएनए बनता है, आरएनए से प्रोटीन बनता है, और प्रोटीन सारे फंक्शन करता है. अब सारा जो डीएनए है उसकी जो स्टडी है, एक टोटल डीएनए का जो सेट है ना किसी के अंदर, उसको हम लोग बोलते हैं जीनोम. एंड दैट इज व्हाई वर्ड जीनोम, एंड दैट इज व्हाई स्टडी ऑफ जीनोम बिकम्स जीनोमिक्स. तो अगर हमें किसी का डीएनए कंप्लीटली स्टडी करना हो और उसके बेस पे if you have to come out with a medicine or diagnosis or nutrition or anything, so वो सारी स्टडी आती है जीनोमिक्स में. अब हम में और किसी एनिमल में या किसी प्लांट में फर्क डीएनए लेवल पे है. एक मेल और फीमेल में डीएनए लेवल पे डिफरेंस है, दो फीमेल्स के बीच में डीएनए लेवल पे डिफरेंस है. दैट इज व्हाई समबडी इज शॉर्ट, समबडी इज टॉल, किसी के बाल काले हैं, किसी के डिफरेंट है. उसका मतलब ये है दैट वी ऑल हैव सम डिफरेंसेस बिकॉज ऑफ विच वी आर डिफरेंट. नहीं तो सारे ह्यूमन बीइंग एक जैसे होते अगर सबके डीएनए एक जैसे होते. बट एट द जीन लेवल देयर इज डिफरेंस इन ईच एंड एवरी ह्यूमन बीइंग. सो मोस्ट ऑफ अस आर unequal because of that, and that is the beauty of life. तो उसका क्या मतलब निकलता है? उसका ये मतलब निकलता है कि फाइनर लेवल पे आपको जो दवाई काम करेगी ना, वो शायद मेरे को उतनी नहीं करेगी. अगर मुझे आप फीवर की कोई मेडिसिन दे रहे हैं, तो वो फीवर की मेडिसिन हो सकता है आपके लिए 90% इफेक्टिव होगी, मेरे लिए 60% होगी, किसी के लिए वो टॉक्सिक भी हो सकती है, एलर्जिक भी हो सकती है. एंड दैट इज लाइक इन डीएनए. आज क्या होता है कि व्हेन यू गो टू अ डॉक्टर, तो वो एक जेनेरिक बेसिस पे आपको दवाई दे देता है कि अच्छा बुखार है, बुखार की गोली खा लो, एंटीबायोटिक उठा के दे दिया. बट दैट्स नॉट द वे. यू हैव टू रियली लुक एट माय जीन्स, एंड वो मेरी जीन या डीएनए की पूरी सीक्वेंस विल बी स्टोर्ड इन क्लाउड, एंड बेस्ड ऑन दैट इन फ्यूचर डॉक्टर्स विल मेक ऑल द डिसीजंस, कि ये डीएनए के बेस पे आपको अल्जाइमर होने वाला इस एज में जाके, या आपको ब्रेस्ट कैंसर हो सकता है, या आपको डायबिटीज हो सकती है, और आपको ये दवाई टॉक्सिक हो सकती है या नहीं हो सकती. So you will actually align with the help of softwares. सब कुछ it will be all programming and software based, which will tell that this is the drug of choice. So ये सब होने जाने वाला है. Everybody's genome will be sequenced. आज की डेट में भी देयर आर किट्स अवेलेबल जहाँ पे वो स्वैब लेके आपका डीएनए की सीक्वेंसिंग के लिए भेजते हैं, बट थिंग्स आर नॉट दैट पॉपुलर राइट नाउ. इट्स being used for cancer and few things only, but in future it will be universal for everyone. It will be like Aadhaar, you know genomic Aadhaar ID, I would say genomic Aadhaar card बन जाएगा सबका, और सबका
जी.
उसका नंबर होगा. डॉक्टर पहले वही देखेगा, बचपन में सबसे पहली कुंडली वही बनेगी सब.
I think this is a very groundbreaking advancement that is happening, because not only will it help the humankind, work on the longevity of human life, but the quality of human life as well.
Absolutely, absolutely. अब आपको एक और अच्छी सी एग्जांपल देता हूँ कि विद 5G कमिंग इन, यूएस में बैठा हुआ सर्जन ऑन लाइव आपकी सर्जरी यहाँ होती हुई देख पाएगा, एंड ही विल बी देयर एंड ही विल बी एबल टू गाइड यू कि ये वाली आर्टरी को साइड पे करो, इसके नीचे से हटाओ और इस चीज को देखो और इसको काटो, इसको मत टच करना, सो वो वहां बैठ के 5G अपना अवतार बन के वहां आपके साथ ऑपरेशन थिएटर में होगा डॉक्टर के साथ. दैट इज द पावर ऑफ 5G, which is again going to help healthcare and all these fields, biotech and everything. So technology is emerging and merging. So two big trends which are happening.
आपका इसमें कोई एक पर्सनल प्रोजेक्ट जिसके बारे में आप पैशनेट हैं, जिसके बारे में आप और रिसर्च करना चाहते हैं, एंड समथिंग दैट यू विश फॉर दैट कम्स इन द मार्केट एंड रियली brings a change in the quality of a regular human?
तो मैंने जो बताया यही मेरा एक्चुअली थ्रस्ट एरिया है. सो आई वुड लाइक टू कम आउट विद प्रोडक्ट्स, artificial intelligence in the field of diagnosis, using genomics for personalized medicine. So I would be needing, interface between coders, coding guy, very intelligent coding guys with very good biologist, R&D scientist, and all that needs to go to customers through digital marketing, कहलो या a very sharp e-commerce based execution system so that the output reaches everyone easily. So मेरा भी यही विजन है, कि हम इंडिया को इतना कैपेबल बनाएं इस सेक्टर में ताकि हम लोग यहाँ के लिए प्रोड्यूस करें, यहाँ के कस्टमर्स को, साइंटिस्ट को फायदा हो, एंड द सेम थिंग वी कैन रेप्लिकेट आउटसाइड, फिर हम आसपास के देशों में लेके जाएं. So my interest also lies in the same area.
And I'm very certain that India is abundant in the kind of intellect power that is there in when it comes to research, when it comes to actually implementing all of these technologies. So I think that there is a very bright future that lies ahead of India.
Absolutely, absolutely. हमारे ही लोग पूरे वर्ल्ड में छाए हुए. You can see, so many now CEOs. अभी recently FedEx के CEO is also ex-Indian, ex-IITian. अभी बने just last week, I forgot his name. So हमारे ही लोग सब जगह globally छाए हुए हैं. So if we can connect dots with all of them, bring some of them home, not physically, even if, through their thoughts and their collaborations and all, we have a long way to go. I think we have very bright minds. Our scientists are best in the world, our doctors are best in the world, our engineers are best in the world. So हमारे यहाँ problem of plenty है, इसलिए लोग भाग जाते हैं बाहर. But इन सब का फायदा बहुत जोरदार तरीके से उठाया जा सकता है. I am very confident about that.
और ऐसे ही आज एक शख्स के साथ आज हमने भी इंटरव्यू कर लिया.
नहीं ऐसा कुछ नहीं है. So but yeah, we all learn from each other. So I'm very happy to share what I know at least.
I think it was a very wonderful session, Mr. Singh, and I am sure that the audience was able to really understand the scope of the R&D sector that is booming in India right now. And this is a future tip for the entrepreneurs as well, how to go about their businesses and a potential industry that they can start working in.
Definitely, and I think you are also doing a wonderful job in terms of, talking to people from different walks of life and, bringing information for everyone and, building up a strong ecosystem here. So I really hats off to you, the way you are doing to FIM.
Thank you, sir.
For sure.
It was wonderful having you. Thank you so much for your time. And
my pleasure always. My pleasure always, Dr. Dravya. Nice talking to you.
Thank you, Mr. Singh. Namaskar.
Thank you. Have a wonderful day ahead. Bye.